Hello everyone and welcome to this episode of Trust TV. I'm your host Memo, and with us we have Dr. John Willardsen. Thank you for being here, Dr.
Thanks,
Willardsen.
Memo. Appreciate it.
And in today's episode, we're going to be answering a question or a comment that was left in one of our YouTube videos. And the comment says, "I'm scared of pain in this procedure. How is this managed?" So Dr. Willardsen?
You know, that's a great question. We do get a lot of comments on all of the videos that we post on YouTube. And I think pain and fear are the two main ones, right? And so, you know, this is a good question. And, you know, if I take a look at this x-ray here, here's a patient that's obviously before we had done any work on them. And as I look at this x-ray, it's just screaming pain. Like he's got a tooth here that's got decay that's basically into the nerve. That certainly has to be painful. He's got a tooth that's broken off at the gum line here. That too has got to be painful. He's got an infection over here with a broken tooth here. There's so much going on in this x-ray, but this patient was like riddled with fear coming into the office. And so, but their mouth certainly had to be in pain. So, you know, as far as the, you know, being afraid or fearful of the pain, post-operative pain, because there's different types of pain. This case would be more of like a chronic pain, just kind of a dull ache. Every so often he probably did, or she actually, probably did get like a real intense type of pain, certainly infection. And so, you know, taking these teeth out and addressing the issues really alleviates a lot of the pain. And so, but that doesn't necessarily mean there's not pain going through the process. You know, there's certainly going to be some post-operative pain after the surgery. The surgery is done under general anesthesia, so they're asleep. It's not as if they're going to feel any pain during the procedure. In fact, when we do a case and we put them under general, I also give local, and there are many reasons for that. You know, we want to make sure that the patient feels no pain at all, because sometimes even under general, you know, they could be semi-conscious when they're waking up. But we give local at the beginning, we give local at the end to make sure that they have no pain at all during the procedure itself. Okay, so let's take a look here now. Of course, in this case here, all of these teeth have to come out. And it was a journey. This patient had to go through a journey. They overcame their fears. They overcame the anxiety. They overcame the thought of the pain. And let's take a look at their after photo. And just take a look here. So now initially the pain was a number one factor for her. It actually kept her from doing anything at all. Like, she didn't even want to go to the dentist. She was not seeing a dentist, but it also caused so many problems within her mouth that it got to the point where she had no choice. Like, she had to do something. So, but all that aside, and the idea of pain or no pain or fear or no fear, it was certainly worth every ounce of effort because it transformed her life completely. Now obviously she's not in pain anymore. She's confident. She's able to eat. I mean, it's completely transformed her life. And I know she would tell you that the pain was an issue in the beginning, and it is for 99.9% of the patients that I see. But once we get started on the process and they kind of see how we navigate through that pain, you know, the issue or the concerns that they have, and as we address each of their concerns, and then we end up in a situation like this, you know, every single one of my patients would say it's worth every effort, the time, and the expense involved in these sort of cases.
Yeah, and not only that, but one thing that I also notice is that they think it's going to be more painful than what it is. Like, after everything's done, they're like, okay, that wasn't that bad, because it's, like you said, it's managed. And that's one thing that I want to talk about is, other than anesthesia, you said we do local, but we also do other things to manage the pain.
Yeah, absolutely. I mean, after the surgery, once a patient's awake, of course I I reinforce with local anesthetic, but also they have pain medication, that they're going to use for a couple of weeks after surgery. But also, Memo, the surgical technique that I use is going to minimize the pain because it's so streamlined. Like, what that means is I'm very focused on what my objective is, so I can get in and get out to try to minimize the amount of trauma, the amount of swelling, and also as a result the amount of pain. So, really having the experience and being able to deliver on what I'm promising because I know where I'm headed, that minimizes the pain, the post-operative pain. And then as well as the medication that we give the patient so that we can control their pain after surgery as well.
Yeah, of course. One thing also that we talked about is that we call it's the last pain they'll ever feel.
Right.
Because they've been feeling pain, like actual pain, because they can't chew certain things, and I mean, we all know that even just going to the dentist and getting a cleaning, that like when they poke your gums, that's painful.
Yeah.
So this is the very last pain you'll feel, and from that point on, you won't feel any more pain or anything. Right. I actually have a story that I want to share. I was in Vegas about 6 months ago, and I saw this firsthand. I was with my family, and they were doing some work inside, some remodeling work. So there was an older gentleman, and I was surprised that he was still doing work, it was good. And we were having lunch. And my mom was like, "Hey, you should come have lunch with us." And he was like, "No, it's okay. I'm okay. I don't want to like intrude or anything." And she was like, "No, for sure. We made extra." And she really wanted to eat. And at first I didn't understand why he didn't want to, but the fruit that she made was kind of, you needed to chew it. Mm-hmm. And no one noticed but me, because I kind of see this every day. And he was eating the food very slow, and he only ate certain things. He only ate the soft stuff. And I could kind of tell that I think he either had dentures or was missing something. And my mom didn't understand, because after he left, she was like, "Oh, I wonder if he didn't like the food." Yeah. Or I wonder what happened. And I told her exactly, like, it was just, like, he can't choose certain things.
Something was going on
for the pain.
Sure.
But not only that, not like the physical pain, but I think also like the emotional pain that people feel of like, oh, I'll go out and eat in public.
The psychological pain.
Psychological, yeah. Like I can't
not
even
offending your mom, for example, but he can't chew. So he also doesn't want to choke,
And he also, I noticed, because I kind of wanted to bring it up, he also didn't want to bring up the fact that, like, hey, sorry, I can't chew this food. Like, I'm not going to eat it. He just kind of left it and left. So, yeah, psychological pain. It's just, there's quite a bit of pain other than physical pain that we don't really, I guess, think about.
Yeah, for sure.
Which, again, that is why it's so important for people to get this done right away. It's because you're going to get it all out of the way. It's going to be just a tiny bit painful. Not even that, because it's managed. We manage it pretty well. Right. But after that, that's it. You won't have any psychological pain or physical pain or anything like that. Yeah,
it's interesting because, as I've done thousands of cases, and, initially pain is always a factor. In fact, at my initial consultation, we always discuss pain. It's one of the first things the patients bring up. But once they've kind of done that first step and we've done the surgery, they're really not complaining about pain anymore. And actually, a lot of them will say, "I'm very surprised that I had so little pain after the procedure." And so, to me, a lot of it is surgical technique and just having had the experience and knowing how to manage the case to make sure that it's as least invasive as possible. And, training is critical with that. We've talked about in the past, there's, in fact, I was talking to a close friend of mine who's now working for a big corporate company, and they're sending all of their general dentists to a school to learn how to place implants. And so he was kind of picking my brain because he knows that's what I do. And it's kind of shocking to me that, this big venture capital company is sending all of their dentists in their company. There were 2,500 dentists that were going to this implant training center for a weekend that are going to be doing these cases and comprehensive big cases like this case here that require so much more than just a weekend course. And in fact, if we look at, and to me, that is a case where these patients are going to have a lot of pain, not just pain from after surgery, but if I was practicing on somebody and didn't know how to, for example, raise a proper flap, so to, like I say, minimize the invasiveness of the surgery. If I can raise a proper flap of tissue and then close it quickly and prepare the osteotomy or the hole where the implant goes and do all of that stuff very methodically and quickly, it decreases the amount of pain. But if you have a doctor who is kind of fumbling around and not really knowing how to manage the tissue, how to manage the bone, how to manage a graft, how to manage the implant osteotomy or the hole, the drilling of the hole correctly, if any of those things goes awry, the pain is going to go through the roof, but more importantly, the implants will fail. In fact, if I take a look at this x-ray here, so here's a patient, spent $60,000, and for, this is an x-ray, so for a dentist or a doctor, you look at this and you go, oh wow, this is a complete catastrophic failure. But he has, what has he got? 7 implants on the upper, and at one point he had 6 or 8 implants on the lower. This implant's failing, this implant's failing, this implant is just barely hanging on. I could pull it out with my fingers. These were holes where implants were. This was an implant hole here. So, and this was 6 months ago.
Oh, wow.
This is a painful situation. Not only did he went through the process of having the surgery and that initial, pain of a post-operative surgical procedure, but then the pain of having lost all these implants, the pain of having lost all that money, the pain of now, when I talked to this patient, he's like, now how am I going to get implants? Well, I have to regenerate. I got to extract all these implants. All of them need to come out. I have to regenerate all the bone. I mean, not to mention it adds an additional $30,000 to the case simply because I'm not working with a clean slate. Had I placed these implants, or a doctor with a skill set that is very methodical and understands surgical techniques, understands tissue management and bone management, all of these things have to be taken into consideration. And a weekend course at an implant center in Mexico, in Tijuana, is not sufficient to manage this sort of a case. And this is a classic example of this. I mean, we see this almost weekly in our practice. And, unfortunately, because, that's real pain. Now he went through the pain of the surgery at first. Now the implants are failing. Now he's got to go through it again. But more importantly, the time that he spent and plus the money that he spent is now gone.
Yeah.
And oftentimes in these cases, to regenerate this bone, that's very painful, and it can be a long procedure. It's totally doable. When I look at this case, fortunately he did call me directly, like, yes, I can help you. Yes, I can regenerate this bone. And yes, we will have success in this case. But this is completely avoidable. But the patients have to do their homework. These all-on-4 implant centers that are popping up on every corner that are promising teeth in 24 hours or whatever the gimmick of the day is, that's painful.
Yeah.
So it's, we are providing a procedure that is a long-term procedure that has to be done methodically. The doctor needs to have training, both surgery, prosthodontics training, and there's no other way around it. Some guys can get away with it and get lucky on a few cases, but when you end up with cases like this that are absolute catastrophic failures, it really, it's not good, and it's not, it's hard for the patient because they have to go through the whole thing again. So
yeah.
So there's many different types of pain is my point here.
Yeah.
It's not just post-operative surgical pain, but the pain of having lost everything, having tried. He did the best he could. He trusted the doctor he went to. he confided and he said, okay, let's go for it. He wrote him a check and went ahead and went for it. But at the end of the day, having used cheap implants, not understanding implant surgery, and just kind of haphazardly play, I can tell because of the position of these implants that it was not thought out properly at all. And as a result, the whole case failed. So this is what, at Trust Implants, I am on a mission to change this. I'm on a mission to change the industry, because everything is all on four. You know, every patient gets all on four in the industry, not at Trust Implants. You know, we provide patients with the most quality materials, implants, and surgical technique. And in the end, that's how we are successful. That's what allows us to ensure that our patients' investments are secure. And we see it. We see it all the time. Patients that are just completely thrilled, and it's a life-changing procedure, you know.
Yeah, thank you, Dr. Willardsen. So I think the main things that our viewers should get from this video is, well, number one, that we do all we can here at Trust Implants to minimize the pain.
Yes. Yeah.
And the number two thing that they should know is that they can also do quite a bit from their part to minimize the pain by doing their research.
Yes.
And finding a doctor who knows how to do these procedures, and be able to help them minimize the pain.
Absolutely, yeah. And minimize to maximize the success.
There, okay.
You know, maximize the success, maximize the benefit of this procedure, because it is a third chance. It's a third set of teeth. And there are not many situations in life where you get a third chance. You know, the first chance is you got your baby teeth, second chance you got your primary or your permanent teeth, and then the third chance is if you've lost your permanent teeth, now you can have implants. So there's not many situations in life where you get three chances, and this is one. And you know, we do see every day, we see patients when we finish cases where their lives have been changed for so much better.
Yeah. No, and I've seen that myself being here, and it's definitely true. Well, again, thanks, Dr. Willardsen. Thanks for watching this episode of Trust Implants. If you feel that these videos are useful, make sure that you hit that like button, you subscribe to our channel, and if you have any questions or just anything that you'd like us to talk about, make sure you leave a comment in the section below. Thanks for watching Trust TV.